Hello, everyone. Welcome to our Healthy Aging presentation, where we'll talk and share about our learning experience in our action area of integrated care. We're grateful to have interviewed Professor Hillary in this endeavor and discussed remote patient monitoring programs of Home and Community Support Services Southwest. Next slide, please. So here's an overview of what you can expect from our presentation. My name is Rowan, and I'll be discussing the literature. Team learnings will be tackled by Joni and Mil Grace, and Sanjit and Mary will share about the impacts. Next slide, please. As defined by the World Health Organization, an integrated care system for older adults means that older people get the health care they need when and where they need it. So as a response to this integrated care action area, Ontario has developed an interesting remote patient monitoring program called TeleHomecare. So it's a 6-month self-management program using the VVFi app. For now, it's only applicable to the COPD and CHF patients. What it does is that patients will report their health status or vital statistics every morning through the app, and the nurse will remotely monitor them and coordinate with the care team as necessary. Next slide, please. So patients who registered to the program will have these devices: the weighing scale, blood pressure monitor, oximeter, and the tablet. Next slide. So why is the action area integrated care relevant to healthy aging? Next slide, please. Healthcare and social care are typically fragmented from one another, and the way that these services are organized creates complications for older people and their families who need both types of services. Next slide, please. 2 pieces of literature were identified that tells us the progress and importance of this specific area. TIP is the first one here. It's a telehealth program in Ontario that links patients and their primary care physicians or family doctors with an interprofessional team of nurses, social worker, PTOTs, and any health professional applicable to the patient's case. So this addresses a common limitation, which is the lack of time and resources to address comorbidities within a typical 15-minute primary care appointment. Thus, TIP provides immediate problem solving on a range of issues that put complex patients at risk, enhances care coordination, and aligns care goals with appropriate reductions in medication and serial specialist consultation. Next slide, please. eShift is for at-home palliative care. It's established as a response to the shortage of nurses and increased demand for patients to receive palliative care at home. So instead of a nurse making intermittent home visits and working one-on-one with clients, the eShift model, the nurse is situated remotely and is responsible for 4 PSWs who provide care to one client in their home for 8 hours a day. The nurse is able to monitor, mentor, and manage care for 4 clients at 4 different locations at the same time in real time. And this has greatly improved the patient's quality of at-home hospice care and provide relief to informal caregivers. Next slide, please.
The process, start the process. Once registered, the patient and the nurse will connect through the provided tablet and later via personal phone once the client is more stable. The patient are supplied with monitoring kit which include blood pressure monitoring, weighing scale, pulse oximeter, and a tablet. Next is the nurse will be monitoring the patient vital information weekdays from 8:30 a.m. to 4:30 p.m. And next is the patient will log their biometric data every morning. And the last is the vital signs parameters is set for per patient's baseline and will send an alert to monitoring nurse if it's out of range.
So the benefits of telehome care, it has a continuity of care. The clients are offered with education and coaching by the healthcare providers online. The patients are involved also in their care. They are empowered to manage their own condition in the comfort of their own home. This is also very efficient. It is the telehome care who coordinate arrange and deliver the monitoring equipment directly in the client's home. So after 3 days, it will be directly delivered door to door by the purolator. So the client doesn't have to go somewhere to pick up the kit. And it is said to be integrated because it is directly linked to the paramedics and to the Ontario Health Team, which includes the acute hospital setting, the nurses, and the primary care physician, even the home care. Next, please. The other benefits is that it delivers quality of care, thus decreasing their need to visit emergency department or the hospital. Since this home care, telehome care, online monitoring is feasible, a lot of cost is saved, and it is producing a very positive outcome, not only to the patient, but also to the hospital's admission for unnecessary admission. You don't need an internet connection for this. You just use the cellular and it will work.
The impacts of telehome care. Number one, it promotes positive lifestyle, maintains a positive physical condition, avoid unnecessary stress, and also it is easy access to patients' conditions and informations. Next slide, please. And also it promotes and the promotion and education to the public about the existence of remote patient monitoring. And it will engage more patients to improve self-management to their conditions since it is working. Government should allot of budget for this program to reach even rural areas. And also telehealth improves the integration and support on the use of technology to the geriatric community, such as digital literacy can also improve the social connectedness in older adults. Wide use and acknowledgement of telehealth brings a more convenient access to care for both older adults and their families, less need for transportation and institutionalized care and better care management at home.
While we talk about other impacts, the most important role that we play is understanding research on the subject matter, hence ensuring that the issue surrounds healthy aging is achieved by all the members of the society. That includes all the students or all the healthcare team member, and as well as the patients. The government should provide free mental and physical health service in the lives of the elderly service, which is usually that present in our society, but it should still put more emphasis on it. Healthy aging can be supported through providing the elderly with financial help that will ensure that they address the socioeconomic needs that they have and get the best outcome from their life. Telehome care, this program is also one of the example of it. If we need more information and if you want to know more about Ontario Telehome Care, then these are the program, these are the numbers and emails that you can reach out, and they will definitely provide you more information on it. Thank you.